It may not seem like it, but life in colonial Philadelphia was sick. But literally, everyone was dying of disease. Luckily, the health situation has improved since then, but it's been a bumpy ride. You know, epidemics, politics, manslaughter, they make life so much more interesting. This podcast will walk you through the health situation in Philly from the 1700s to now, including medicine, sanitation, and cultural views. You'll get an inside look at why Benjamin Rush is actually a scumbag, what happens when you ignore people with the names of Game of Thrones characters, why politics is the opposite of progress, what happens when you don't expect the Spanish influenza, and how Philadelphia is just as important today as it was in 1776. In the early 1700s, when the U.S. was a British colony, life was basically terrible. People were mostly worried about making money or fleeing persecution, so health was not the top priority. Hygiene was abysmal, as people still thought bathing would let water seep in through your pores and drown you from the inside. Waste was dumped in holes called privies, or into the river where drinking water came from. No one understood disease, and most thought it was God's way of punishing people. The only medical schools were in Europe, so out of the 4,000 doctors in the colonies, there were only 300 to 400 with medical degrees. Philadelphia was pretty important because of that, since 82% of its doctors actually had degrees. Medicine was mostly herbal remedies and family recipes passed down by housewives. In other words, the situation was grim. Then, in 1765, the first medical school in America was founded, the Medical School of the College of Philadelphia, now called the University of Pennsylvania. A medical degree back then was a bit easier to get than it is now. It only took 2 years. The first year was math and science, and the second year students learned anatomy, medical practices, and the use of medicines. However, only 51 degrees were given out before the Revolutionary War started and classes were shut down. During the Revolution, every doctor with a medical degree, and even more doctors without one, had to serve as surgeons on the battlefield. After the war, things were going great in Philadelphia. It was the capital of the United States, and not just politically. It was a thriving center of culture, like New York City is today. The best physicians were based there, and it was a center of scientific and medical knowledge. Between that and its above-average sanitation system, the other colonies saw Philadelphia as a shining city on a hill, pure and incorruptible. That's when yellow fever hit. A tenth of the population died, and about half of what was left fled the city. Doctors didn't really have a clue what to do. Most ran around screaming like chickens with their heads cut off. Okay, not really, but they were completely unprepared for an epidemic this size. At this point, they hadn't even figured out the disease was contagious yet, much less that it could be carried by mosquitoes. They still had their own theories as to what caused the disease, though. The biggest one was that, noxious effluvia from local putrefactions were causing the disease by infecting the solids of the ether, and thus poisoning the atmosphere. In English, that means that bad smells from human waste, dead bodies, or the river were polluting the air, causing disease. They called this the miasma theory. At this point, an important name to know is Benjamin Rush. Currently, he has a couple of schools and a state park named after him, but at the time, he was a prominent Philadelphia physician and creator of many crazy medical practices. In case you couldn't tell, I'm not his biggest fan. He was a strong promoter of the belief that Philadelphia's immorality and general corruption had brought divine punishment down upon it in the form of the yellow fever. He developed the American system, which said that all diseases were really manifestations of one disease, and the cure was to stop the morbid excitement of the arteries, or to drain patients' blood. This sounds crazy to us, but believe it or not, this was a common practice at the time. Even those who didn't follow Rush's American system would bleed patients to relieve an imbalance in abdominal fluids, whatever that means. Rush, however, recommended draining 4/5 of a person's blood, which is twice what it takes to kill even a healthy person. Not only that, but he developed and tested this theory by experimenting on a bunch of unwitting yellow fever victims. If he pulled that now, he'd be locked up for unlawful human experimentation and probably manslaughter. People back then also realized that murdering a bunch of severely ill people was not the way to go. Memorably, one doctor named William Cobbett said that Rush had made one of those great discoveries which are made from time to time for the depopulation of the earth. Justice was served when Rush got yellow fever the next year and had the bleeding treatment performed on him. After the yellow fever outbreak, everything went back to normal-ish, besides everyone's perfect image of Philadelphia being shattered. The Board of Health was founded and started cleansing the streets. Doctors kept bleeding people. People kept dumping their waste into the river. Then, in 1832, cholera arrived in America. Philadelphia was hit hard, and thousands died, but it still had a dramatically lower death rate than either New York or Boston. Many people attributed this fact to Philadelphia's better sanitation system, meaning that Philadelphia threw their waste into the river as opposed to leaving stinking piles of human excrement filling up the streets. This seemed to support the miasma theory, which said that miasmic vapors coming from the filth were what caused the disease. Around the same time, a London doctor named John Snow, no relation to the bastard son of the House of Stark, had traced cholera back to contaminated water. The prestigious College of Physicians of Philadelphia completely ignored this, and the growing number of doctors telling them cholera was spread by contagion, and instead staunchly supported the miasma theory. They had added to this theory by saying that certain people, in this case poor, black, or Irish people, were just predisposed to get the disease. Nothing like some good culturally accepted racism in the morning. The predominantly poor, black, and Irish sections of the city did have 4 times the death rate of the rest of the city, but that was mostly due to the really, really terrible quality of the drinking water there. The College of Physicians only used this to confirm their belief in predisposition. However, as the epidemics continued, the theory stopped holding water. Only the poor, the blacks, and the Irish were afflicted. That's an awful lot of rich white people that just died. They simply weren't adhering to the proper moral code. I don't know, I'm pretty sure that was just a priest and a couple of very upstanding citizens. They just had weak constitutions. Okay, now you're just grasping at straws. When people fleeing Philadelphia brought the disease to Lancaster, the contagion theory was all but confirmed. The discovery of tiny particles in fluids from infected people helped prove the germ theory. It's what we believe now, that disease is caused by tiny organisms, like bacteria or viruses. The College of Physicians continued to completely ignore this, and kept preaching the miasma theory nearly until the turn of the 20th century. In the late 1800s, cholera still had a mild outbreak every few years, but Philadelphia had bigger fish to fry, in this case typhoid fever, which killed hundreds of people each year. By the 1880s, with the general acceptance of the germ theory, scientists had traced the disease to, surprise, surprise, contaminated water. Because of the Industrial Revolution, the number of factories in and around Philadelphia skyrocketed. There was no waste disposal system, the river was the waste disposal system, so the drinking water was full of not only human but also industrial waste. After the death count shot up in the 1890s, the city built a water filtration system, which means they built a reservoir where the solids in the water could settle before they piped it into the city. The death rate did drop a bit after that, and the water was no longer brown, so that was a plus. However, it didn't do much about the bacteria actually causing typhoid. People began to urge the city government to filter the water, but alas, politics once again stopped any progress from being made for 20 years. Seriously, they spent 20 years arguing over whether they should filter the water that they already had or pipe in water from a distant location, whether it was more important to filter the water or meter it, and who was going to pay for these hypothetical filtration systems. Finally, in 1912, the city built 5 filtration plants to treat its drinking water. Death rates plummeted, and absolutely no one was surprised, except possibly the remaining miasma theorists at the College of Physicians. In 1913, they started treating the water with chlorine, and the death rate fell even further. Funny how drinking water that's not full of deadly bacteria might be better for you. Everything was fine and dandy for approximately 4 years, and then the Spanish flu came around. In 1918, some soldiers stepped off a boat from Boston, unwittingly beginning the worst epidemic Philadelphia has ever seen. A quarter of the city was infected, and over 16,000 people died within 6 months of the disease's arrival. You're probably thinking, wait, but the flu isn't as lethal as, cholera, yet this epidemic was the worst in Philadelphia's history. What made it so deadly? The thing is, nobody expected the Spanish influenza. In all honesty, though, you couldn't have found a worse time for disease to strike. First of all, World War I was ending, so there were almost no medical workers in the entire city. Most doctors, nurses, and aid workers were overseas for the war, so Philadelphia was severely understaffed. Second of all, the war had created many jobs, so the city was packed with workers. The tenements and slums were overcrowded and filthy, so disease spread quickly. Not only that, but the city believed they knew how to handle it. They dealt with the last flu outbreak fine, but they had no way of knowing that this flu was the very resistant H1N1 strain. They published a bunch of articles about how they had everything under control and said to avoid large crowds. They immediately ignored their own advice by holding a huge concert in a park, which prompted more than 600 new cases within the next 3 days. The hospitals couldn't handle the numbers of sick people, and the one singular morgue in the entire city really couldn't handle the bodies. Mass graves were dug by volunteers, and churches were turned into emergency hospitals. Luckily, the disease was gone almost as fast as it came, only ravaging the city for about 2 months before it died down. Nothing much happened epidemic-wise during the rest of the 20th century. During the Great Depression, the Board of Health helped people in poverty get medical care. In 1950, the city finally started building a sewer system and a sewage treatment plant. In the 1990s, Philadelphia activists were some of the most outspoken in getting laws enacted that help people with HIV and AIDS, and they're now working to get funding for cure research. Today, the Children's Hospital of Philadelphia is consistently ranked one of the top children's hospitals in the nation, for issues ranging from cancer to orthopedics. Many excellent colleges and universities are in or near Philadelphia, and it's as much a center of learning today as it was in colonial times. And there you have it, ladies, gentlemen, and otherwise, the roller coaster ride that is health in Philadelphia. You saw how medicine, sanitation, and cultural views are part of health. You now know why the world needs to posthumously press charges against Benjamin Rush. The College of Physicians will forever bring my pompous fake British accent to your mind. You'll never take clean water and plumbing for granted again, and you've seen how deadly the flu can be. Finally, you know that Philadelphia's influence on health continues to this day. All this knowledge is yours now, but what you do with it is up to you. This has been Anja Castro-Diephouse reporting to you not so live from the city of brotherly love on May 15, 2016. Congrats if you caught my terrible references. Thanks for listening, and enjoy your day.